This is Dr. Dennis Patterson, and I'm here with Melissa Delamora, one of my nurse practitioners. Patients in chronic pain, we always see that they have an underlying pain problem or issue. And it usually doesn't matter what it is, if it's an underlying cervical facet issue, if it's arthritis of a shoulder. Usually, what ends up happening is patients guard. And what I mean by that is a way to stop the pain is to tighten the muscles around that area and stop moving that area. And so a lot of patients will develop myofascial pain as a secondary consequence of their underlying primary pain reason. And so that's something that we see all the time in this clinic and treat and address. Main way we do it is by trigger point injections. And you've done trigger point injections over the year. How would you describe what a trigger point injection is to patients?
So a trigger point injection is just a technique of trying to release those muscle fibers from clamping down on each other so we can relax that muscle around the area. There's a few different ways that you can do that. We usually use lidocaine and we fan the needle out and it just basically breaks up the muscle fiber.
Now, is this a special procedure that they have to have done, like in a procedure room or the surgery center or the hospital?
No, this is something that we do a lot of times at just an office visit. They will have, maybe some underlying pain, maybe not, that we're treating separately, but that day they're very uncomfortable. We are really just treating that muscle spasm, so we can usually do it on the fly with a med check or whenever they're in the office. And just help them out for that day, and then it usually is temporary relief, but it can last, a couple to few weeks, give them some good relief.
I think you hit the nail on the head. From what you described, it doesn't resolve their pain, or it doesn't make it go away. It gives them good temporary relief. And then, if we can help out with that secondary pain, then that allows us to put a plan together to treat the underlying pain that's causing that pain.
Correct.
Is that kind of how you see it?
Yep. Yeah, I mean, if we're not treating the underlying pain at all, it's just going to keep coming back. Same problem. It's going to keep spasming, guarding. But if we can do that temporarily until we can treat the underlying pain, or a lot of time we'll do triggered points with physical therapy. So somebody will have a big spasm, we'll send them to PT, and then trigger points in the office can help PT. They'll get more out of their PT session.
And that's what's great about our clinic, is having that multi-specialty feel to it, is that we have the physical therapist that's right down the hall, or a massage therapist right down the hall, and they can say, hey, God, this person really has a tight trigger point or some myofascial pain that needs to be addressed. And when I really try to work with them, it's too painful for them. Now, can trigger points be repeated?
Absolutely. Yep, so a lot of times if a patient will have trigger points at every med check, so if we see them once a month, they can come in and do it every month that we see them until we address what's underlyingly causing that muscle spasm.
And a lot of times, instead of increasing their pain medications or maybe doing a more invasive procedure, sometimes we can just do a round of trigger points, and that breaks the pain cycle and gets the patient back to doing good. And so I usually like to keep the trigger points kind of as my ace in the hole when patients are kind of getting that emergency situation, that we can treat them that way and prevent them from increasing their med dosage or going to the emergency room.
Right, yeah. I know we've talked about Botox. Botox is every 3 months, and a lot of times I'll have gals come in just to do trigger points in between that Botox appointment once a month, just to keep everything loosened.
Any complications from trigger points? Have you ever seen any over your career working here?
No, you have to be careful when you're over the lung field so that your needle doesn't go too deep, and that's just a technique that we know not to do, angles of needles and length. And then, you can have some injection site pain. Anytime you poke through the skin, you can have a risk of infection. I've never seen that happen. So, yeah.
Yeah, only other thing I can think of is maybe bruising or bleeding, but that's going to go away. That resolves on its own. And actually, to me, that shows that we've actually did a good trigger point, because we broke the tissues up if you see some bruising in the area. And that kind of gets to the other point. What is a trigger point doing? What we're really trying to do is bring the patient's own blood supply to a tight muscle. And when that muscle's gotten tight, there's no blood supply to that area, and so it can't heal. And so us mechanically using the needle to disrupt that tissue allows bleeding into that area, which then allows the body to heal itself. And I think a lot of people don't realize that's what we're doing. It's not about what we inject. It's more about how we mechanically disrupt that muscle to allow their body to heal itself.
Yes. A lot of times patients will say, in the parascapular area, they'll feel numb and tingly and all of these kind of nervy feelings, and it's because the muscles clamp down that hard that it's actually pinching things off.
Yeah. Pinching their cutaneous nerves. You're exactly right. Yeah.